just thought I'd show you the marks on this very nice lady who's having a breast augmentation. This is where the scar is going to be. This is where I'm going to make the incision. I've talked about this before. We make the incision much smaller now than we used to, so 2.5 centimetres. This is the lower extent of the implant, and this line here, which is curving down, is actually straight when our patient is standing up, and that connects both nipples to each other. But you can see when she lies down, it becomes curved because the nipples raise up. So this is Aggie just blowing up our sizer. That's 50 cc's. We use a sizer, which is essentially a temporary inflatable implant, to test that the implant's perfect for our patient. So what are we on there, Aggie?
This is 200.
So 200 cc's. I can see I just need to free up a little bit tightness there. So that's 250 cc's. This is when the nerves come in, so I'm very careful here just to not damage the nerves. 300 cc.
So this is 330, which is potential patient size.
And then go up a little bit more.
And then that's the 360.
So what do you think would fit best?
It's the 330.
Yeah. There's very little in between
That's
them.
360.
I think probably 360 would be best for our patient.
Yeah.
Because we're particularly looking at the cleavage to make sure it's perfect. So we're going to go with the 360 moderate profile Nagel implant. That's the sizer being deflated, and now I'm just going to remove it. This is something we're often asked: what do you do with a nipple piercing in a breast augmentation? And the solution is we take it out at the beginning of the operation, and then we put it back in straight at the end of the operation. Now Aggie's just put the nipple piercing through the nipple, and the next stage is just to get the little screw and tighten it up there on the bar. This is the piercing in place, and the interesting thing is what you do is you screw up the solid side, not the side with the knobble on it. That makes it much simpler and safer, and there we are at the end with the nipple piercing in place. This is the end of the operation. I just thought I'd show you the scar, a very short scar, 3.5 centimetres long, with buried stitches on both sides. And you can see we've got a really nice natural breast shape.